Dr. Jacqueline Rubito here with my lovely assistant, and today I'm going to demo some myofascial release via the scraper, is what I call it in lay terms. It's instead of using my fingers, and she has a lot of neck pain. You saw her on her previous video, so I'm going to start with her scapulothoracic area, also known as the shoulder blades, or the gap between your back or spine and the shoulder blades, because they are tight. She does have a lot of pain up here. I'm going to use my fingers for that because I don't want it to overpower her at all. So I do this with the clothes on. There's a lot of different ways to do this, and if you're into the, I think it's a gaucho method, like there's a lot of different types of scraping. I do not move that aggressively just because of the population that I see. And so you want to kind of think about the muscle fibers that you're doing, and I can change the angle of which I'm doing it at, and she'll tell me if the pressure is too much or too little. You will see me doing this the most on people with plantar fasciitis at the bottom of their feet, because that graininess or that sandiness that we're feeling, I want it to be nice and smooth, kind of like a baby's bum. And that helps the tissues to glide and move maximally, so you get improved range of motion, less pain, and then you can go on and strengthen, right? Because you have better range and no pain. And so I'm kind of just getting a feel for her shoulder blade here. And so this can last as long or as short as the person can tolerate. I do have some people that just come in on a cash pay basis, and we see where they're tight that day, and we just go for it from there, because if you're aggressively working out, why not? This feels so good. And it helps get rid of all these trigger points that are in here. And so again, for her, I'm going really, really light, because I know her neck is sensitive, and I want to keep it super pleasant. I also do not, there's called like little petechiae, so that's when the blood comes up to the surface, and there'll be like a bunch of little red dots. I do not go that aggressive, because I have found, again, with this population that I work with, I made that mistake one time, and it just doesn't, for what I'm doing, doesn't work. So I do more of a conservative method, if you will. And then I do like it when people wear like this type of fabric or the stretchy fabric, so that it's not actually directly on the skin, because some people's skin, excuse me, is very sensitive. And another place you'll see me do this a lot is the IT band, or the side of the leg here, that also gets very, very tight and can be a culprit with hip pain, knee pain most commonly, patella pain, or kneecap pain. So you'll see me doing that a lot there. And then people's quads, or the tops of their thighs, is where I work a lot as well. Especially if their patella or kneecap movement is poor. There's a nut stuck in my throat. Is that okay? Yeah. And so since this is her first time having this, I'm not gonna go for hours on end, right? I'm just gonna do a few minutes to improve the mobility of the fascial layer, and that again is under the skin. Think of it as a nice spider web, and we don't want micro traumas or like bumps and grooves in that spider web. We want to keep it nice and smooth so that we can glide. Right here. And right, there's two different sides of this. We got the smooth side, this side, pointy side. So I can move this in a bunch of different ways, so you'll be seeing that happening a lot too. And again, this is just one example of how you can do this. There's 100 different ways to achieve what you might be doing. So if you have another PT that does something similar but slightly different, that's totally okay. It very much depends on the population that you're working with as well. And especially I found people with like chronic pain issues, really hypersensitive with their skin, and so I have found doing like direct skin contact really is not helpful for them and can send them into a flare-up, which is not what I want to do at all for, again, this group of people. You need to do the wall slides, girl. Your shoulder blades are up. And I found another trigger here. So sometimes you'll see me use my fingers also. I also have lacrosse balls and tennis balls. You'll see my assistant is very good with the balls as well. She's trained on how to do trigger point release via ball work. Sometimes you might see me just use my fingers, I might use a forearm or an elbow. It just depends on the person's tolerance for what we're doing and what's the best method for them. So these are all the different tools in the toolbox that you'll see come out. And sometimes one might work really well for you, one may not help at all, one might be too much, and so as long as you tell me, then we can adjust it super quickly to keep you on the right path. Transition to laying on the tennis balls. If you have any questions, please let me know.
Let me get the